Joining me now is Dr. Sajina Geever-Geese, the Executive Medical Director for Gynecologic Oncology at Rochester Regional Health. Doctor, so great to have you with us.
Thank you so much for having me, Allie.
Absolutely. So this month is Gynecologic Cancer Awareness Month. We're discussing the importance of women prioritizing their care. Let's begin here. What are the most common gynecologic cancers you see in women?
So some of the most common gynecologic cancers are cervical cancer, uterine cancer, fallopian tube cancer, ovarian cancer, and so it's cancers of the reproductive tract. And Allie, I just want to tell you that almost 30,000 women are diagnosed and actually die from a gynecologic cancer every year. And most of those cancers are preventable. And what's really heartbreaking, tragic, is that 4,280 women die of cervical cancer, and every single one of those deaths is preventable.
Tell me about preventing some of these cancers. I know there's the HPV vaccine. Can you talk to me about that?
So the HPV vaccine, the HPV virus is actually what causes cervical cancer. It's actually a cause of a lot of vaginal, vulvar cancers, head and neck cancers, penile, anal cancers. And so we've figured out that there's an actual virus that leads to cancer, and we can prevent it. But the key thing is you actually have to get the HPV vaccine prior to any sexual exposure. So that's key. So ideally, boys and girls should be getting it at 11 and 12 prior to any sexual touching, exposure. It doesn't have to be penetration or intercourse. But you can get it up to the age of 45.
Wow. And another important thing, other than the vaccine, is screening too. Can you talk to me about screening for these cancers?
Absolutely. So for cervical cancer, there is screening. We do Pap test or Pap smears. We do pelvic exams, and oftentimes we can diagnose precancers and intervene and diagnose things early. And what's heartbreaking for me is I see women all the time who've had a history of an abnormal Pap smear but never followed up, Allie. They never followed up. And so by the time they see me, they have abnormal vaginal bleeding, they have pain. And then finally, one of their friends, somebody else tells them, you need to go see the doctor. And then here I am, telling a woman, looks just like us, who's been busy in life, taking care of their kids, taking care of their husband, taking care of the family, right, going to work, and then just never made their own health a priority. I'm diagnosing them with an advanced cancer.
Sure. I want to stay with that screening. When should women get screened? What is your recommendation there?
So screening can start pretty early at the age of 21. It's going for Pap tests, pelvic exams. But what I want to stress is even outside of screening, go get your pelvic exam. If you have an issue, vaginal bleeding, most common symptom of endometrial cancer, which is the most common gynecologic cancer, it can be caught early. It's often diagnosed as a stage 1 and is curable. But if you put it off, now we're talking about stage 3. If you are having symptoms of vaginal discharge, bleeding, pain, bloating, that's often a symptom of ovarian cancer. You know, these other symptoms can be thought as IBS, it can be thought as other issues, but really you need to see your doctor, and don't make the excuses. Friends, tell your girlfriends, go see the doctor, get that exam.
Well, thank you, Doctor, so much. This is such an important topic, and we appreciate you talking about it with us.
Absolutely.
We'll have much more on this over for you at rochesterfirst.com.